Himalayan Healthcare, which is partnered with the University of Colorado at Boulder. So, the University of Colorado works with Himalayan Healthcare, which is also called HHC, because the organization is located in Nepal, where it is 75% mountains, and the rural population in the mountains have poor access to healthcare and education. In fact, the schools are only open 6 months a year since they are in such a region. And so the Himalayan Healthcare Organization focuses its efforts on healthcare, education, income generation, and what the GlobeMed at University of Colorado does is that they conduct interviews about the One Home, One Toilet project, which is basically a program that helps families build their own toilets so that they're less likely to get sick by pooping somewhere else. And they choose recipients for the midwife training program. And they also improve the One Home, One Kitchen project. And what that is that it essentially improves the diet of the people in the region. So, what I just talked about was basically the organization and how the partnership looked like before coronavirus. And some good news before I get into the bad news is that the Himalayan Healthcare Organization is located in Ruby Valley, which is pretty far, so they haven't received any coronavirus case. So that's one advantage of being in such a remote location. However, the organization as a whole has faced some funding issues because a lot of the funding that they have been receiving has been diverted to COVID-19 relief. And so, what this organization has done and is currently doing is that they gave up one of their hospitals and repurposed it as a quarantine center. And they also have been using some of their funding to provide PPE, cleaning supplies, and thermal guns to healthcare providers. And they also have been able to provide COVID-19 safety trainings to the women in these areas. And these women would basically educate their families about coronavirus. And so this pandemic has hit this organization pretty hard in that there are fewer field guides in the areas that they are able to work in. And then so now I'm going to shift my focus to GlobeMed at the University of Colorado and how it has been affected. So unfortunately, the benefit dinner last year was canceled, and this was one of the biggest fundraising events the organization had. And they also canceled Grow, which was pretty tough on them because Grow is such a big part of their GlobeMed chapter, and I'm sure for like any GlobeMed chapter. So they were really forced to rethink how they can conduct partnership without Grow. And though fundraising and partnership has been greatly impacted, the campaigns team has been killing it, and they've been coming up with some pretty creative solutions. So almost all of their fundraisers this semester were online. So what they did was that they sold coffee, succulents, and they also set up an Etsy page for I'm gonna pronounce this wrong, but Jivan Kala, which is basically a line of sustainably made handcrafts. And basically what they did with this originally is that they would sell it in a store in Nepal, but this was forced to shut down because of the coronavirus. And so now they're currently working to build a website for the Himalayan Healthcare Organization so that they can sell these crafts directly on their website. And they're also working to set up a partnership with a local business in Colorado to sell Jivankala for the long run. And as you can tell by now, they've been through a lot, and this pandemic has been has been doing a lot on their organization and their partnership. But I did talk to the co-presidents, and they talked a lot about how they were able to think how this organization can work beyond monetary contributions and what the organization is without Grow. And yeah, hopefully that helps.
Okay, so the next organization is the Primeros Pasos, which is partnered with Globe